In your Friday morning medical news, Wisconsin reporting its first child flu death of the season. State health officials say respiratory illnesses are running high right now. RSV is hitting young children especially hard. Nearly 6% of emergency room visits for kids under 5 involve RSV. State Health Officer Paula Tran expressed her condolences to the family, noting the child did have underlying health conditions. Officials are urging everybody 6 months and older to get vaccinated.
Vaccination is the best way to prevent complications like hospitalizations and, in this case, unfortunately, death. If you have not been vaccinated, um, I would strongly suggest that you consider at this particular point, not only for the person itself, but for those people who are around you.
Nationwide, there have been 16 pediatric flu deaths this year. The FDA is authorizing the marketing of Zyn nicotine pouches after the agency conducted an extensive scientific review about their safety. The authorization applies to 20 Zyn pouch products and is the first time the FDA has given the green light to nicotine pouches. The FDA says studies showed a large amount of adults who use cigarettes or smokeless tobacco switched to these nicotine pouches, and they pose a lower risk of cancer compared to cigarettes. But the FDA does stress there is no safe tobacco product, and the new authorization does not mean that the Zyns are FDA approved. A federal judge giving several states the go-ahead to proceed with a lawsuit to restrict the abortion drug mifepristone. The move comes despite a Supreme Court ruling last June that the drug can stay on the market. Now the state's attorneys in Missouri, Kansas, and Idaho argue some moves by the FDA have allowed the flow of mifepristone across their state borders. The states allege that undermines their own abortion restrictions. The lawsuit also challenges FDA rules that have allowed patients to order the drug by mail without an in-person doctor's visit. People in LA's fire zone certainly have had to worry about their physical health, including concerns over air quality. But it's not just their physical health that's in danger. It can be their mental health, too. Brian Abel reports.
With the danger and destruction wildfires can bring, it's easy to understand the stress people experiencing them are under.
A disaster like this can have huge mental health impacts. There can be signs of anxiety, depression, and post-traumatic stress disorder.
Up to 40% of impacted communities can show signs of these clinical symptoms, says Dr. Mishra, including anger, shock, sadness. There's the uncertainty of losing a home, a neighborhood, a neighbor. The stress can bring cognitive impacts too, making it hard to focus when everything around you feels threatening.
People will feel very distracted, unable to pay attention to their daily life activities, and they will also have poor ability to make decisions.
Both victims of a disaster and first responders are vulnerable.
Firefighters are all under the threat of PTSD as well in a situation such as this. They have received some amount of resiliency training, but they're not immune to these mental health impacts.
The mental health impacts can linger years after the smoke clears if they aren't addressed, says Mishra. Talking with a trained professional can be key. Other coping mechanisms like listening to music to de-stress and deep breathing exercises can help, along with volunteering and talking with others going through the same thing.
This is collective trauma, which requires a collective healing and us supporting each other.
And the doctor also says when speaking with others, be mindful to not have the conversation be all doom and gloom. That may not help. Try to shift to a survive and thrive mentality instead.